All right. Hi, everyone. Good afternoon. Thank you so much for joining us. If you have friends who were interested in coming but couldn't attend, this session will be recorded and I can provide the video and slides for participants in about a day or two. So I am just so overjoyed to welcome these esteemed panelists to our presentation, That's Grandma's Money, Financial Caregiving Tips for Families. So just wanted to, before we go into the content and I introduce our guests, just wanted to give a brief background on our organization, MBLS. As you may know, there is a criminal right to an attorney, but not a civil right to an attorney, but so many low-income people need one. MBLS and so many organizations in Maryland, like Legal Aid and Pro Bono Resource Center, connect people who need an attorney to volunteers. And we do work in the following types of law: family law, housing, consumer. We do expungements. We have a tax clinic and estate planning. You can always call and get powers of attorney, wills, and advance directives. So today's speakers, first we will hear from Lisa Schifferle. She is a senior policy analyst in the Consumer Financial Protection Bureau's Office for Older Americans. She leads the office's financial caregiving work, as well as the office's work to combat elder exploitation. Ms. Schifferle's career in consumer protection spans more than 20 years. Before the CFPB, she worked as an attorney at the FTC, the Federal Trade Commission, where she led trainings on scam prevention. She served as the FTC's identity theft coordinator and litigated fraud and data security cases. Before that, Ms. Schifferle was at Maryland Legal Aid, where she represented low-income clients in consumer, bankruptcy, housing, public benefits, and employment. Then I will have a conversation with Lisa Johnson. Lisa Johnson has been the primary caregiver for her 95-year-old father, Elmer Smith, for the past 8 years. After retiring from Verizon in 2002, her desire was to be a companion to seniors. This ultimately prepared her for the role she plays in his life and the lives of other older adults. Linda Stewart is the Caregiver Program Manager at Johns Hopkins Bayview Medical Center. In 2015, Linda spearheaded the development of Called to Care, an innovative program to prepare and support individuals caring for older adult loved ones. Through Called to Care's supportive services and a network of organizational partners, Linda provides professional guidance, training, health resources, and uplifting programs to educate and motivate those who are called to care. Thank you to the three of you for sharing your time and your talent today. I'm now going to turn it over to Ms. Schifferle to speak about financial caregiving.
Thanks so much, Andrea, and thanks for inviting me here today. As Andrea said, my name is Lisa Schifferle, and I'm a senior policy analyst in the CFPB's Office for Older Americans. I'm really excited to be with you today, especially as a former Maryland legal aid attorney. I'm glad to be here working with MBLS again, which provides such important legal services to Maryland residents. And I want to start by just thanking you all for the work you're doing as caregivers or working to support caregivers. It's so essential. And it's often overlooked, and we know it's exhausting, also rewarding, but very important. And during the pandemic, even more people have been called on to become financial caregivers. In fact, according to an AARP study, about 1 in 5 people in the United States act as an unpaid family caregiver right now. So today I'm going to tell you about some of our resources for financial caregivers, and hopefully they'll make lives easier for you as a caregiver or for the caregivers that you work with. Let me just quickly give you a brief disclaimer, which is that anything I say is my opinion and doesn't necessarily reflect the opinion of the CFPB. And I'll start by telling you a little bit about the CFPB's Office for Older Americans. If you're not familiar with the CFPB, the Consumer Financial Protection Bureau, we're a US government agency. We were created about 10 years ago to help make sure that banks and lenders treat you fairly. So if you have a problem with your credit card company, a car loan, or a home loan, then the CFPB is a place where you can turn for help. And I work in what's called the Office for Older Americans. And so we focus on research, policy, and education to help protect older consumers from financial harm. And we also create a lot of tools and resources for financial decision making as we all get older. You can find all the materials I'll talk about today at consumerfinance.gov/older-americans. So today I'm going to talk about considering a financial caregiver, know your options. So maybe you are early in the caregiving process and you're noticing that there's a loved one that might need help with managing their finances, or maybe you're planning ahead for your own financial future. So what this publication does, and what I'm going to go over in this presentation, is knowing what your options are to help you choose what works best for your situation. We're going to go over informal caregiving options, formal caregivers, and also some tips on choosing a caregiver. This is a publication you can find at consumerfinance.gov/MSEM, like managing someone else's money. So let's first talk about informal caregivers. There are 3 different types of informal caregivers. A lot of people don't even think of themselves as caregivers per se, but they're just helping out someone who they care about. So what our guide talks about are conversation partners, trusted contacts, and convenience accounts. So let's look at each of those one by one. First, a conversation partner. It's just when you give a trusted relative, friend, or professional an overview of your finances. You don't have to share everything. You can share as much or as little as you want, and you're not giving up any control by doing this. For example, you might ask a banker to send a copy of your statements to your child or to your accountant, or you might ask a trusted friend or relative to join you when visiting your bank. Or it could just be sitting down with an adult child and saying, I just want you to know these are all the financial accounts that I have, so that if anything happens to me, you'll know where to go to try to help me. On the next slide, we'll talk about a trusted contact person. This is another informal caregiving option that you can take advantage of. And what this does is that if you name a trusted contact person on your brokerage or investment account, it allows the financial institution to contact the trusted person in certain circumstances, like if they think you're being scammed. So if I were to name my brother as my trusted contact person and I suddenly started wiring money overseas, then he would get a call saying, check in on your sister. This is out of character that she's suddenly wiring tens of thousands of dollars to someone in another country. So this is something right now that's offered on all investment accounts, and some banks are starting to offer it too. And the thing to know about it is that it just is a notification of financial exploitation. It doesn't give the trusted contact person any access to your money or even to see how much is in the account. So this is a good step for somebody who still has control of their finances and is able to manage them themselves, but maybe just wants a second pair of eyes in case something unexpected happens. It's also a good tool for somebody who is dealing with dementia or other age-related decline. A convenience account is another type of informal caregiving setup that you might want to consider. This is if you need a little more help and the person actually needs help depositing or withdrawing money or writing checks. The important thing to know about this is a convenience account's not the same as a joint account. With a joint account, money is jointly owned and the joint account holder automatically gets the money when you die. So oftentimes people set up joint accounts because that's what they know about, but this can have unintended consequences, which is why we talk about the convenience account. So just to give you an example, let's say that my mother decided to add me to an account to help her start managing writing checks and depositing money. If she did it as a joint account, then if she were to pass away, then all the money would pass to me, which is probably not what she would want. She would want it divided between me and my brother. If she set it up as a convenience account, that wouldn't change the ownership of the money in the account or give me the right to the money when she passed away. Also, if I got into debt and we had a joint account set up, then the creditors could come after her money for my debts. So that's why it's very important, if you're setting this up, to set it up as a convenience account, not a joint account. So those are some of the informal caregiving options. Our guide also talks about formal caregivers, because there may be times when somebody needs more than just occasional help and they need to name a formal caregiver. And so this piece discusses the formal caregiving options that include power of attorney, guardian, trustee, or government fiduciary. We'll go over each of those, and we also have a guide for each of those that goes into more depth to explain them. But before I go into each of those, I do want to tell you about some tips for choosing a financial caregiver. And this is also included in that considering a financial caregiver, know your options piece. These are some questions to ask yourself when you're trying to decide who should I name as my financial caregiver if something happens. So you want to make sure it's someone you trust, someone who you can talk to and be open with about your wishes and who will honor those wishes, and also someone who's willing to take on the responsibility. If someone's really busy and doesn't really have time for it, then they may not be the right person. Also should be someone who can keep good records and keep their money separate from their own. Also a good time to ask some of those hard decisions and hard questions. Because sadly, we see a lot of times, caregivers may take advantage of the person they're caring for if they have an underlying, say, gambling addiction or drug or alcohol addiction. There are a number of times where you see that the caregiver then uses access to the money to fuel their addiction. So when you're thinking about choosing a financial caregiver, you may want to think about, if family members or friends have these issues, we hope those people overcome those issues, but they may not necessarily be the people you want to choose as your financial caregiver. So time to think about all sorts of questions when choosing a financial caregiver. So let's talk about managing someone else's money and these more formal guides for financial caregivers and what it means to be power of attorney, guardian, or any of these other formal caregiving options. We do have guides, like I said, that talk about tips for fiduciaries, and this slide shows actually where you can find them, consumerfinance.gov/MSEM. There's also an introductory video that helps you learn about them. And then on the next slide, you'll see a copy of all the guides. There's a different colored guide for each type of fiduciary, and fiduciary is just a legal word for financial caregiver that's set up in a formal legal relationship. So what you'll find in these guides are tips and resources, information on identifying benefits the care recipient might be eligible for, warning signs of financial exploitation, and other information on where to get help. And these are designed for regular people who are thrust into these roles and are wondering what they are supposed to do. So what is a fiduciary? Like I said, if you're managing money for a loved one, you might hear this term fiduciary and wonder what it means. And it's basically just a legal term that means anyone who's legally named to manage money or property for someone else. Could be named by power of attorney, which is done in a legal document. Could be a government benefits fiduciary, which is named by a government agency. Could be a guardian or conservator named by a court, or a trustee named in either a legal document or in a court. So let's look at each of those types of fiduciaries. First is a power of attorney. This is the most common type of fiduciary. As I said, it's created in a legal document. So what happens when you create one of these power of attorney documents is one person, who we call the principal, gives someone else, who we call the agent, legal authority to make decisions about their money or property. So often people make power of attorney so someone else can handle their money if they become sick or injured. It's really something that a lot of people can and should create alongside when they're creating a will. One thing to know about, a lot of people say, well, why should I create this power of attorney? They give you control to name who you want to manage your finances, and they also make things easier for your loved ones if you become unable to manage your finances. And you can set up the power of attorney so you retain control until you're no longer able to manage your finances. Another thing to know about these is there's a healthcare power of attorney and a financial power of attorney. I know somebody who had completed a healthcare power of attorney and then got in a bad medical situation, pulled out the healthcare power of attorney and thought they also had financial power of attorney, but didn't realize there are actually two different documents. So they only had authority for their loved one to have healthcare power of attorney and make healthcare decisions. If they wanted authority for financial decisions, they have to create a separate financial power of attorney document. So that's a common mistake or thing that people don't always realize. It's important to create both the healthcare power of attorney and the financial power of attorney. And you can name different people. You can have one person who you want to make healthcare decisions and another person who you want to make financial decisions. So let's talk about another type of fiduciary, which is a Social Security representative payee or VA fiduciary. These are specifically for government benefits. If someone's getting Social Security or VA benefits and they need help managing those benefits, then the government agency will appoint someone to do that. The important thing to know about it is that representative payees and VA fiduciaries only manage the government benefits. They don't have authority over any other financial affairs or property or medical matters. So if you're someone's Social Security rep payee or VA fiduciary, and you want to also be able to manage the rest of their finances, then you'll need a power of attorney or guardianship. And then on the flip side, if you have a power of attorney, that does not necessarily mean that you can manage their government benefits too. You still are supposed to get the government agency to name you as representative payee or VA fiduciary. It will be easier if you can show, hey, look, I was already named as the power of attorney, so this person trusts me, and that will usually make it easier to be named the government benefits fiduciary. But you do have to take that step, and it's something for people to understand that the government benefits fiduciary only covers the government benefits. This guide is a good thing to have to help explain that to other people. So let's talk about what's a guardian of property. This is probably the next most common after power of attorney. And this is when a court names someone to manage someone else's money or property. On the slide, you see the name Roberto because that's the name we use in one of our guides. Each guide has like a sample person that you might be managing money for. And so these slides are based on the one related to Roberto. So Roberto might also have a guardian of the person, which relates to healthcare decisions. So that's kind of like with the power of attorney, there's one related to health and one related to finances. There's a guardian of property and guardian of the person, which could be the same or the different person. But one story I just want to share briefly about guardianship and about power of attorney is the story of one of my grandmas who was in good health in her 70s, but unfortunately, while she was trying to turn left, a gravel truck hit her car. And she was immediately put in a coma, and she did not have a power of attorney. So while she was in the coma, our family had to go to court, get guardianship set up so that my uncle could, continue to pay her bills while she was unable to do so herself. So had she had a power of attorney, it would have been a lot easier. In case of getting the guardianship, there had to be doctors come and say, and make a ruling that she's no longer able to do this. There had to be a court proceeding. So that just gives an example of why the power of attorney documents are so important. Of course, the guardianship is a good alternative if you don't have that power of attorney, and it was good. It worked out well in the end, but the power of attorney can really save time and money for family members at what's often already a difficult time. So let's talk about trustees. That's the last type of fiduciary that our documents cover. And what we talk about with trustees are what's called a revocable living trust. So in this type of trust, you give someone else legal authority to make decisions about money or property in the trust. So the trust also specifies who gets the money or property in the trust after the person dies. So one thing that's nice about the trust is you can just put some money or property in the trust. So you could say, I want this $20,000 to be in trust to my adult child, or I want my vehicle to be in trust to my other adult child or to my grandchild. And so this gives them control over just what's in the trust. And it also gives them the right to that property when you pass away. So those are 4 different types of fiduciaries that may be good for you depending on your situation and your needs. One thing in common about all these fiduciaries, whether you're a guardian, power of attorney, trustee, government fiduciary, is there are certain duties, and those duties include acting only in the person's best interest. So that means avoiding conflicts of interest, managing their money and property carefully, which includes making an inventory of money, property, and debts, investing carefully, finding out about government benefits, keeping the person's money separate, and the guides discuss how to title bank accounts and how to sign checks on behalf of the person, depending on which type of fiduciary relationship you have. And then finally, keeping good records, including receipts and notes, even for small expenses. This can help with benefits determinations. It can help if there were a power of attorney abuse case. It can also help, sometimes guardianship has certain reporting requirements to the court, so you'll need good records for that. So let's talk a little bit more about each of these duties. The first duty I said is to act in the best interest of the person who you're the financial caregiver for. So let's say that Roberto is the name of the person whose finances you're managing. And so a conflict of interest would happen if you make a decision about Roberto's money that benefits someone else besides Roberto. So as a fiduciary, you have a strict duty to avoid that type of conflict of interest or even the appearance of conflict of interest. So the guides give some examples because sometimes it's easier to understand it by looking at an example. So for example, imagine a car. You use Roberto's money to buy a car and you use that car to drive him to appointments. But most of the time you drive the car just for your own needs. That could be a conflict of interest. Then also another issue that often arises in terms of conflicts of interest is doing business with family. Like for example, imagine that Roberto needs repair work in his apartment and you hire your daughter and pay her from Roberto's money to do that repair work. That can be a conflict of interest, even though the work was needed, because you might have put your own interest to benefit your child in conflict with Roberto's interests. So those are just some examples of conflicts of interest that people may not think of till you hear the story. So you think, oh, I'm not going to do any conflict of interest, but then you hear the story and you're like, oh, I could see how that could happen. So also don't loan or give Roberto's money to yourself or others. Gifts may be allowed in certain circumstances, but it's important first to check with the court, government agency, state law, and the terms of any legal document or court order. Usually if it's a gift or donation to charity that the person is given every year throughout their life, they'll let you do that, continue to do that, but you do need to check first. And then very important to get approval before paying yourself, or else you could end up in a situation where abuse is being alleged. So the second duty is managing money and property carefully. These are a few tips, which are to make a list of money, property, and debts. The list might include things like checking and savings accounts, cash, pension, retirement, stocks and bonds, even jewelry, furniture, and other items of value. And then it's also important to protect money and property. Like you might need to put valuable items in safe deposit boxes or change the locks on the property and make sure the home or other property is insured. Also important to pay bills and taxes on time if that's part of your responsibility. A lot of people overlook taxes and forget about that aspect of it. So it's important to know if that is part of your responsibility as a fiduciary? And if so, to follow up on that. Finally, it's good to check benefits eligibility. It's possible that the person you're caring for is eligible for some benefits that may help them, whether it's food stamps, housing assistance, Medicaid, disability payments, or others. So benefitscheckup.org is a great way to find out what the person is eligible for, and also the elder care locator, which you can find at eldercare.acl.gov, is a great free resource to find out about a whole variety of resources in your community, whether it's food delivery or other things. So let's talk about the third duty, which is to keep money and property separate. And it might sound obvious, but separate means separate. So don't deposit Roberta's money into your own account just as a convenience, before putting it somewhere else. And again, avoid joint accounts for some of the reasons we talked about earlier. And know how to title the property and how to sign. And these guidebooks that I mentioned, which are available all for free, and we have them in English and in Spanish at consumerfinance.gov/MSEM. They'll explain you how to title property depending on what type of fiduciary you are. And the last duty I want to talk about, which is a duty for all financial caregivers, is keeping good records. So that means keeping a list of everything you receive and everything you spend money on. I've heard some people say to, keep receipts even for small expenses. Like, for example, write $50 grocery, ABC grocery store, May 2nd in your record soon after you spend the money so you don't forget. Some people say to take photographs of the receipts so they don't fade over time and so you don't lose them. You can have the photographic evidence of it, and avoiding cash payment can help you better track what you've spent money on. And of course, if you are a guardian or some other type of fiduciary that requires reporting to the courts, then it's critical to file the reports with the court as appropriate. And they'll tell you if you're named guardian or otherwise what your duties are and when and how to file those reports. So those are some of the duties that our guide goes over. The guide also talks about warning signs of financial exploitation, because one of the other parts of being a financial caregiver is making sure that the person doesn't lose money to fraud or scams. Because even if you're doing your job very well and very carefully and following all the fiduciary duties, if the person ends up sending, $10,000 to an online love interest who says they're going to meet them and fly to see them, then that's going to be obviously a big problem as well. So some things to keep an eye out for in terms of warning signs of financial exploitation. It's obviously if some money or property is missing that you weren't expecting to be missing. If there's sudden changes in the person's spending or savings, if they still have some control over spending on their own. Also good to look at some sort of psychological factors, like if the person seems afraid of a relative, caregiver, or friend, or if that other caregiver or relative keeps the person isolated and doesn't let them speak for themselves, or if they're trying to control that person's decision. There can also be other subtle changes in behavior, like using the ATM a lot, not able to pay bills that they usually could pay, making new or unusual gifts. So those are some things to look out for. The guide also talks about some common scams, because we know that if people are able to recognize scams, they're far less likely to lose money to those scams. So the guide goes over the grandparent scam, which is where someone calls and says, "Grandma, I'm stuck in another country. I was just in a car accident," or "I'm in jail. I need you to wire me money right away." But it's really just someone pretending to be your grandchild. There also are tax scams where people pretend to be the IRS, say you owe back taxes. There are fake charity scams where people pretend to be legitimate charities and ask for your money. And there are a whole variety of other, phone scams. I'm sure that everybody on this webinar has gotten some variety of phone scam at some point in their life, if not at some point in this past week. So some more examples of elder financial exploitation include investment fraud and scams. These can be even free lunch seminars that some areas serving older adults will offer people free lunch and give you some sort of new investment idea. There's also an increase in cryptocurrency related scams, so that's something to keep an eye out for. Lottery and sweepstakes scams, where they tell you that you've won a lottery, but you just have to pay a little fee to get your prize. And then there also can be, more simple old fashioned, like a family member who steals money, or a caregiver who's in the home and steals money from your purse or from, under the mat or wherever you keep money in your home. And finally, the exploitation by a caregiver or a power of attorney or someone else in a fiduciary relationship. So that's what our guides go over, are managing someone else's money guides. And like I said, you can get these all for free. You can download them at consumerfinance.gov/MSEM, or you can order them in bulk order for free at the website listed here. And if you have any question about the guides, you can contact us at olderamericans@cfpb.gov. We'll also take questions at the end of the presentation. But before we get to that, I want to tell you about a couple other resources that we hope will be helpful to you as caregivers or as people who work with caregivers. The first is called Planning for Diminished Capacity and Illness. And this is an advisory that we did with the SEC, the Securities and Exchange Commission. And it basically talks about planning ahead to keep in control of your finances as you age and if you do experience diminished capacity. So it has advice for planning for your financial future, getting your documents in order, watching out financial exploitation. It was recently updated to talk about trusted contacts, which I mentioned at the beginning of the presentation as an option of a way to get a flag if, or for the trusted contact to get a flag if they see signs of financial exploitation. On the next slide, you'll see our coronavirus website. And we know that the pandemic has not only affected people's health, but also their finances, and those financial impacts are still being felt. So we created a central hub at consumerfinance.gov/coronavirus. And these resources are actually available not only in English and Spanish, but also in Chinese, Vietnamese, Korean, and Tagalog. So it covers topics like how you can financially protect yourself, credit and debt management, student loan repayment, mortgage relief options. If you know someone who is behind on their mortgage or on their rent, there's a special sub part of this, which you can get to directly by going to consumerfinance.gov/housing. That tells people their options if they're behind on their mortgage or rent. Now on the next slide, you'll see our Money Smart for Older Adults campaign. This is an awareness program we developed in collaboration with the FDIC, and it helps older adults identify fraud, scams, and financial exploitation. So some of those scams I was talking about towards the end of the presentation. If any of you on this call do go out and give presentations in the community, this is a great resource because it has an instructor guide that walks you through things. It has a PowerPoint you can use, and then it has a resource guide that you can hand out to participants. And it is available in English and Spanish, and it offers over 2 hours of content on a variety of scams targeting older people. On the next slide, you'll see our fraud prevention handouts. These are a really simple and engaging way to empower older adults to protect themselves from scams. And really, they were designed originally to use with places like Meals on Wheels, where they would hand out a meal and put one of these fraud prevention messages underneath the meal. Each one is on a different type of scam. We have one on romance scams, one on online safety, one on veteran-related scams. So they're really a brightly colored and engaging way to get out some fraud prevention messages. And people now are using them not just as placemats, but as handouts, posters, and the like. So these are great things to order. Again, you can order them in bulk for free, hand them out in your community, at libraries, community centers, or if you go out and give presentations. So on the last slide here, you'll see some contact information. Consumerfinance.gov/older-Americans has all the resources I discussed today, as well as a whole lot more, a lot of resources that are helpful to older adults and people who care for them. And then managing someone else's money guides, which were the focus of most of today's presentation, including the considering the financial caregiver guide, and also the guides on power of attorney, guardianship. Those are all available at consumerfinance.gov/MSEM. And finally, you have my email there. I'm happy to take questions at the end, but you can also email me after the presentation if there's anything you want to connect with there. So with that, I want to thank you for your attention. I'll look forward to your questions in a little bit, but I will turn it back to Andrea to go to our next speaker.
Great. Thank you so much, Lisa, for all that valuable information. Now I'm so happy to speak to another fabulous Lisa, Miss Lisa Johnson, a caregiver from our community. Miss Lisa, I wanted to ask you some questions about the care of your father, and because we've talked a little bit before this presentation, and you are a very responsible financial caregiver, and I think that your experiences can be very instructive to our listeners. So first, could you tell me about yourself?
Yes, good afternoon, everyone. My name is Lisa Johnson. I was born in Baltimore City. At the age of 10, my family moved to Pennsylvania. My dad's job moved. I am the only girl of 5 brothers, so that was a little rough. After graduating high school, I went to work for a local bank. 1 year later, I went to work for the telephone company. In 1992, I moved back to Baltimore. Later, marrying my husband, Michael. We have 4 children, 7 grandchildren, and 1 great-grandchild. And in 2002, I retired from Verizon.
Wow. Well, glad you're back in Baltimore. So how did you end up becoming the caregiver for your father, Elmer?
Okay, actually, my dad, even though I was the only one to move back to Maryland, my immediate family still lived in Pennsylvania. And my dad, at the age of 87, had a medical issue and ended up in the hospital. And once discharged from the hospital and rehab, he was not able to live on his own. So we made the decision, my husband and I, to bring him here to Maryland to live with us.
Oh, wow. So how long has he been living with you?
He's been living with us since 2014.
Oh, wow.
Actually 8 years.
So when you became his physical caregiver, did you also become his financial caregiver?
Yes, actually, because part of his health issue in Pennsylvania, when I would go to visit, I realized that he was not paying his bills, his utility bills, his mortgage, and 1 or 2 credit cards. And bottom line is, we did not realize that his house was being going into a lien. It was going to be foreclosed on, but luckily, thank God, we found that out, and we made arrangements to make payments, and all of that was recovered. So with that being said, I started taking care of his bills.
Oh, wow. Okay. And you mentioned before this presentation that your father is a veteran. Can you talk about working with the VA and his benefits through the VA?
Yes, I can. Actually, after about maybe 4 years of being with us, we noticed some changes in his memory and in his social skills. So I actually had taken him to the VA, and he was diagnosed with dementia. And with that, we got him signed up into an adult daycare organization. And as his dementia progressed, and I was not able to continue to take care of him at home, we had him go into an assisted living facility. And when that happened, I was advised from the facility that he might be entitled to a VA benefit. So I made arrangements to speak with a representative who does paperwork for the VA, and that's how it all got started. And he was accepted and now receives a benefit monthly.
Okay. And so how do you manage both? It sounds like he got Social Security before that, and now he gets a VA benefit. How do you help manage that money?
Well, with the VA benefit, as Lisa spoke about earlier, I had to become his fiduciary. And with that, they do a background check to be sure that you haven't had any bankruptcies and you're able to handle finances. They do a credit check. And once that was all done, they made the decision that he wasn't entitled to the benefit. I had to open up a bank account. It had to be separate from any accounts that I have. It was only to be in his name and my name as a rep payee, and that money is direct deposit each month. And I cannot take any money out of that account, no cash withdrawals, no cash deposits, and it can only be used for his personal care at the facility where he is. And it can also help pay for the monthly fee for his services there.
And so Attorney Lisa talked about different ways people keep track of receipts and spending through, keeping receipts or putting it on Excel or writing it down or taking pictures. What is helpful for you?
Well, because I was already taking care of his finances prior to becoming the fiduciary, I just have a file cabinet. I have file folders. I have everything, noted, and I keep his checks, because the one bank he does continues to send checks. So I just keep everything in a file folder, separated. And as far as, making payments, I keep the receipts, because even with being a fiduciary, those receipts are separate from his other receipts. So everything has to be in order for the government, because they will do an audit. Each year you're audited and you have to show proof of where the money went. So it's very important to keep, the receipts.
That's a good tip, to just have everything live in a file folder and organized.
Yes.
You never know.
Yes.
So, between your descendants, your large family, and your brothers, it really seems like you have a lot on your plate. Where have you gone for help? How have you researched help if you needed it, both with his physical care or with his benefits?
Okay, well, actually, I've been very, very lucky, because I have a cousin who is a retired registered nurse. She taught nursing at BCCC, and she also owns her own assisted living facility. So when all of this, started to happen, I reached out to her and she reached out to me, and that's where I got a lot of my information from. And also I signed up, registered for seminars from different organizations that spoke about Alzheimer's, dementia, and how to be a caregiver for those type of people.
That's a great idea. So not just bearing it alone, because I can imagine it was really painful seeing those changes in your father.
Absolutely, and being the only girl in the family, and I now only have two brothers. Well, it all falls on the female. They think, you can do the best you can, for your dad. So it was very difficult, but thankfully I have family members here in Maryland that have helped me along the way.
Oh, great. So how do you practice self-care and avoid burnout as a caregiver?
Well, I am an avid walker. I love to walk, so I do that every day that I can. If it's not raining, I like to go out to walk, and I like to do Bible study with my friends from church. We do Bible study every Saturday, and I do have one senior friend that I go out to lunch with on a regular basis. So I find time for myself, and I do take vacations. When my dad was living with us, I had my family members, my cousins that I'm close with. One of them would come and stay with my dad while my husband and I would go on vacation. So we weren't really confined. We did have some outlets.
Oh, good. So how have your responsibilities as a caregiver changed over the years? You had your dad living with you, and now he's in assisted living, but I'm sure you see him frequently. You're still managing his money. Can you talk about that change?
Yes, when the dementia initially started, we again enrolled him in an adult daycare program where he went every day. They would pick him up in the morning and bring him back home during the day. And so that was a big help as far as my lifestyle went. And once the dementia started to progress and I was not able to take care of him, I was able to have him move into an assisted living facility. And as I watched the changes within him, I actually had to become an advocate, because a lot of times, in the assisted living facilities and the nursing homes, they're not getting the care that they should be getting. So you have to really be an advocate for that person to be sure that, they are treated with dignity and respect. So thankfully, my dad the facility where he is only 10 minutes from my house. So I'm able to visit him frequently, and I can, keep an eye on things that are going on there to be sure that he gets the care that he's entitled.
Wonderful. He's very lucky to have you.
Yes.
Is there anything else that you'd like to share about your caregiving story? Any challenges or things you're grateful for?
Well, the biggest challenge I'm going to go backwards, making the decision to put my dad in a facility was really, really difficult. But I've learned, through the seminars that I've attended and, the Zoom meetings that I've attended, that you really have to be able to make the decision of care, being sure that you do self-care. Because if you're not able to take care of yourself, and if you're sick, you're not able to oversee the care of your loved one. So that was one of my biggest things. It was a hard decision to make, to put him in a facility, but in the end, it was the best decision.
Thank you for sharing that. I've often heard, and I know older adults will sometimes will make you feel guilty and say, oh, I don't want to go into a home, but as long as it's sometimes helpful for both of you, they can get the high level of care that they need from nursing professionals, and you can have some time to yourself as well, and can be recharged and ready to be with them again. So, well, thank you so much for sharing. And Ms. Lisa will also be available to answer questions at the end of our presentation. Next, we're going to hear from Ms. Linda Stewart to talk about the Called to Care program and other resources that she offers through the program.
Thank you so much, Andrea, and to be a part of this team to share with family caregivers. And my goal is always to inform, to encourage, and to inspire our family caregivers to, as Lisa Johnson said, take care of themselves, to stay connected to family and friends, to be knowledgeable about resources and training that will benefit the caregiver and the care recipient, to learn to be discerning and prioritize challenges and troubleshoot issues effectively. And out of this, I think many caregivers, as you may have experienced, those who are on this webinar, and you've heard from Lisa Johnson, to be an advocate for yourself and your loved one. So you've heard a little bit that I began the Call to Care program with Johns Hopkins Bayview. And on the next slide, you'll see some of the things caregivers really need. We found at Call to Care, when I get phone calls from caregivers, they are looking for, as you see on this list, several different things. And depending on where you are on your caregiving journey, some of these priorities will emerge at different times. Certainly you heard from Lisa Johnson, becoming knowledgeable about Alzheimer's disease and dementia support. I mean, that is a big thing. And many family caregivers feel so alone when they're trying to care for a loved one who has dementia or Alzheimer's. Caregivers that we see, that I see, particularly want the education and training, because to be equipped with knowledge and resources and tools enables a family caregiver to feel so much better, so much more empowered, even though it is a stressful and very trying and difficult circumstance at times. Having that education and knowing where to turn is so important. Another big caregiver need is home care assistance. Like, where do I turn if I need a professional to come into my home to take care of my mom or dad or spouse or adult child? So challenging at times, because as we all know, it's home care is usually quite expensive. And over a long period of time, it can really hit your bank account. And we're talking about finances. So many times the family caregiver and the loved one may not have a lot of resources. So figuring out how we can best maximize those resources for home care and other assistance. And then the last two things that which really rise to the top for caregiver needs are mental health counseling and support groups. And I think with the pandemic and caregivers being with their loved ones, often in close quarters, and having to deal with a myriad of issues, mental health really became a challenge. And so finding those resources and support groups are also a great need. And then finally, the respite care, because caregivers definitely need a break. And I know sometimes caregivers think, I can do it all, you still need a break. So that's a big one. And not only to know that it's important to take that break, but to be able to find affordable options. So with that set up, the next slide introduces you to Call to Care. And as you heard from the introduction, Call to Care was started in 2015 by Johns Hopkins Bayview. And as a hospital, we recognize that our patients are really the center of our care. But right alongside are the caregivers. And so now we use the terminology care partners, because without the caregiver partnering with doctors and healthcare workers, we are not able to provide the holistic care for the patient. And so my director, Dan Hale, has been the architect of the Call to Care program. And it has worked very well because we have found we can't do the work alone. We have to team up with partners. We have to team up with other individuals who are knowledgeable, who provide specific resources, and we want to ensure that we have the latest information. So Call to Care is designed to support individuals caring for loved ones with health-related needs or limitations. Our suite of services encompass outreach, consultation, and then connecting to direct services. And I'll show you some of those direct partners, caregiver education and training, the support groups, and connections to services through community and government and faith partners. And this is a really good example of how Call to Care works with organizations, because this webinar is brought to you by the Maryland Volunteer Lawyer Service and the Consumer Financial Bureau. So this is how we work together, teaming up to bring family caregivers the latest information and bring it all to bear. On the next slide, I wanted to just introduce you to some of our community partners and where, as a caregiver, you can turn if you need various services. So of course, Call to Care, who I represent, Maryland Access Point, which is a one number. It's under the state of Maryland, and anywhere in the state, you can call this one number and get connected to all kinds of health and human service resources. Then specifically for caregivers in each jurisdiction of our state, we have a caregiver support program. So I've indicated the numbers for Baltimore City, Baltimore County, and Anne Arundel County, but in each one of the 24 jurisdictions, there is a caregiver support program that provides not only respite and access to information and financial, in some cases, financial support that can, like small grants that would allow you to pay for a respite worker. But there are so many other really great resources. So I encourage you to check out your caregiver support program in your jurisdiction. We heard about the Veterans Administration and their caregiver support program. It's very robust, and a lot of money has been poured into the VA's caregiver support program. So if you have a loved one who is a veteran, they have an opportunity to really get a lot of very good support. And then the Community Resource Guide, which you see a picture there, that is a hard copy guide that's put out by Baltimore City and Baltimore County, but it has all kinds of really great information from finding healthcare resources to locating aging services, their financial support services. You'll see our organizations listed in that Community Resource Guide. And then as we wind down, I just wanted to show you this list of community partners that serve caregivers and older adults. You can go to the Call to Care web page and you'll find, you can click on each one of these organizations and get a direct link, a contact person who will just be able to assist you. So we've tried at Call to Care to really do some direct connecting, knowing that caregivers have so much to do. And if you need something, you want to get it now, and you want an efficient customer service response. And that's our goal at Call to Care, working with our partners to give caregivers direct response and good customer service so that they're able to respond to their needs as well as their loved ones. So we've got a couple of upcoming events I just wanted to highlight for you. But again, you can go to the Call to Care webpage or you can call me. But we've got our Care Circle, which is a virtual support group that's held the first Wednesday of every month. We've teamed up with the BDS Healthy Aging Networks that's led by Betsy Simon. We have a caregivers luncheon planned for September 8th because we know people want to start coming together in a small group. That'll be an in-person event. And then we invite you to join us for the annual Family Caregivers Walk. And that's going to be in the Canton Waterfront Park. And it's just a nice morning of exercise, walking, and getting really great resources that help you along the caregiving journey. So as you've heard from earlier speakers, it's really important that we as caregivers take care of ourselves, that we focus on our health, our well-being, body, mind, and spirit, and that we access all of these really, really great supportive resources. So you can contact me at any time, and we're called to care and happy to assist. So thank you so much, and I'll turn it back over to Andrea. Thank you.
Great. Well, hi, everyone. Thank you so much, Linda. I'm going to put all of our contact information into the chat. Now the floor is open for questions. So if you have any questions for our specific speakers or just a general question, feel free to put it in the chat. Wait a few minutes. Thanks, Jack. Well, feel free, everyone, to email questions to our speakers after this event. You can contact me. You're going to get a survey tomorrow with this link, and you can email me if you have any questions or need something clarified. And again, I will endeavor to get this recording out as soon as possible, so your colleagues and other care partners, Linda, that's a great phrase. I'm going to start using that. Then other care partners can watch and benefit from this. So thank you so much. I think we were scheduled to go till 1:30, but I feel, we're just waiting here, and I don't want to waste anyone else's time. So I'm going to say goodbye. Oh, it looks like Miss Ellen wants you to repeat the website to order the guides in bulk.
Sure, it's consumerfinance.gov/order. I'll put it in the chat.
Perfect.
There was a longer website on the slide, but this is the easier way to get to it. I'll also put consumerfinance.gov/older Americans there, which is how to get to all our publications.
Yeah, I just realized MVLS has the 2017 version, so we are due for some updates, and we'll need to order some more guides. I definitely take advantage of those free guides. People, when we table, really, really love them and love to flip through them. Well, great. Thank you so much again, everyone. I hope you have a wonderful rest of your afternoon. And thank you so much to our talented presenters for sharing their time today. Appreciate it.
Thanks for having us.
Thank you.
Thanks, everyone.